So you just got a CPAP machine and you want to throw it out the window. Let's talk about some common CPAP side effects and struggles, as well as some tips and tricks on how to combat them. Hi everyone, I'm Diane, respiratory therapist here at Sleep Doctor. I have over 20 years experience working in sleep medicine and with CPAP devices. CPAP machines can reduce the symptoms of sleep apnea and can improve the quality of life for people with this condition. Despite the effectiveness of CPAP therapy, some people don't use this device regularly because of the side effects they experience. The first being anxiety and claustrophobia. This is a factor because even before starting treatment, it can be intimidating and overwhelming. You're anticipating the feeling of the mask or the pressure. One tip is to practice during the daytime when there's no pressure to try to go to sleep. This helps train your brain that wearing that mask is okay. Put it on, watch TV, read a book, relax, and just get used to the mask. You also may experience something called air hunger, which is a feeling of suffocation when wearing the mask. That's typically because your starting pressure isn't high enough. A tip for this is to turn off your ramp feature or contact your provider for a pressure adjustment. One of the most common problems in CPAP therapy is dry mouth. This can be fixed with just a few adjustments, like increasing your humidity settings. This is effective because we're increasing the amount of moisture that you're receiving through the mask. One of the easiest ways to fix dry mouth is also to stay hydrated. I know it sounds obvious, but I see it all the time with my patients if they're not drinking enough water. A couple other things you can try are things like a chin strap, which is just a strap of cloth that helps to hold the mouth closed while you're wearing your mask. Another option is a piece of medical grade tape that you're going to place over your mouth to help you keep your mouth from opening. Lastly, you can switch to a full face mask. I know this isn't always the most popular option, but it is one of the best options to help combat that dry mouth. Another issue we experience in our first-time users with CPAP is swallowing air into your stomach. This is called air aphasia. This can cause discomfort, belching, bloating, and flatulence, which nobody wants. New CPAP users benefit from having their pressures lowered till they can acclimate to pressure. You can also elevate the head of your bed about 30 degrees. This positioning helps to eliminate swallowing air. Another thing to do is to maximize humidity, because if your mouth is drying out, you tend to swallow air. So let's increase that humidity level to provide the appropriate amount of moisture. And finally, one of the biggest issues in starting CPAP therapy is the lack of consistent use. You do not get the full benefits of this therapy if you're not using it. It doesn't carry over to the next night. You have to be consistent. Work with this machine, not against it. Adjusting to CPAP therapy takes time. Please be patient when starting therapy. And so here at Sleep Doctor, we have an amazing team of sleep experts to help answer any of your CPAP therapy related questions that you may have, from machine troubleshooting to mask challenges or whatever you may be facing throughout your CPAP journey. Thanks for watching, everyone. Sleep well.